Hello guys, welcome to my channel Instant Microbiology and Biotechnology. I'm Dr. Swati and I'm with you to discuss about how this virus, this coronavirus is entering to our body and hijacking the host mechanism, and after replication how it transmit to the other parts of our body, and I will discuss it within 5 steps. Okay, so let's get started. So here, as you know, I have discussed that this coronavirus generally love to attack the lungs, especially the alveolar cells, right? So here it attacked the type 2 pneumocytes, and when it attacked the type 2 pneumocytes and new viruses were produced, then it infected, right? So here you can see the healthy one and the injured one. So now the question is, when this new virus produced, and what happens to the type 2 pneumocytes, right? So what happens, this pneumocytes generally secretes some inflammatory response towards the macrophage, right? Now what this macrophage do, it activates some cytokines named as IL-1, IL-6 and TNF alpha, and this IL-6 TNF alpha then enters to the bloodstream, and when it enters to the bloodstream, what happens? The gap formation occurs, and when this gap formation occurs, so permeability increases, which leads to dilation or vasodilation. When this dilation or vasodilation occurs, the leaking of plasma occurred in a high way, right? So obviously, if the plasma will start leaking, what happens? The alveoli will contract. So here the alveoli will start contract, right? Because all the materials, all the cell debris and your neutrophils, macrophages, all this component, they start coming outside, and it increases the surface tension. How? Because when the this molecules comes outside, and after certain time it again try to get inside. If it will comes inside, then it reduces the surfactant. What are the surfactant? This is the type 1 and type 2. Type 1 generally responsible for gas exchange, and type 2 is the surfactant. So if it will reduce or destroy the type 2 pneumocyte, means the surfactant, obviously the surface tension increase, and if the surface tension increase, it will destroy the alveoli. So these are the 5 steps how this, after replication, this virus infecting the type 2 pneumocyte. So these are the 5 steps. You can go back and see it again if you want. Now come to the topic, the main topic, like if this infection occurs, what are the main organelles are very much prone to show the symptoms. So here we go. So initially what happens when surface tension increases, this alveoli collapse, and this collapse of this alveoli interrupt in gas exchange, and that gas exchange causes hypoxia. So this is the first symptoms. Now come to the second point. These mediators, when this mediator means this all this macrophage and this type 2 pneumocyte, that they generally activate some mediators, inflammatory mediators, and these mediators stimulate formation or secretion of neutrophils, and this neutrophils try to kill the virus. If it will try to kill the virus, obviously it will produce reactive oxygen species and protease, and this reactive oxygen species and protease obviously will kill the virus, but simultaneously it will degrade the epithelial layer of this alveoli too. That means all these activities again leads to degradation of alveoli, and this degradation of alveoli leads to fighting for the breathing, or our heartbeat increases. So this is the second symptoms, right? Now come to the third symptoms. Third symptoms is, third symptoms is cough and high heart rate, means our heart rate increases, cough accumulate. How? Because this neutrophils and inflammatory mediators, ROS, reactive oxygen species, leads to consolidation that causes cough, hypoxemia and increasing the heart rate. So this is the third symptoms. Then come to the fourth symptoms. Fourth symptoms is the high fever. How it occurs? All these mediators like this, your cytokines and your IL-1, IL-6 and TNF alpha, then travel to the central nervous system via blood, and that gives signals to the hypothalamus. Now this hypothalamus will secrete a special type of prostaglandin hormone which causes high fever, means it indicates the body to increase the temperature to kill the virus. So this is the second symptoms, the fever, the high fever. Now the third symptoms is your septic shock. People may die by this, right? So all this effect leach out further damage of systematic inflammatory responses, and then due to this vasodilation it leads to septic shock because filtration and all can't be proper that time, right? So here are the major 5 points: your hypoxia, high heart rate, high fever, cough, septic shock. So all these parameters are the major parameters that is visible in COVID-19 infection. But after that, if the infection go high, so it reduces the blood volume, that leads to hypertension, and then this perfusion of these molecules, inflammatory molecules towards our liver and kidney can leads to multiple organ failure, right? So here are the major 6 points how we are getting infected, means our other parts of the body get infection, and after getting this infection and the symptoms, that is the incubation period, means the virus need to go inside, it has to replicate, then it has to move to the other organs, then it will show the proper symptoms. So basically if our immune system is very strong, so mostly it will take 14 days, otherwise within 4 days we can see the symptoms. So to avoid that means to avoid the COVID-19, what could be the precautions and the measures need to be taken care of? So in order to know it, stay tuned with me. I'll get back to you with all the prevention measures, cure, and thank you so much to listening me, and kindly subscribe my channel, and if you like this video, please give me a thumbs up. You can follow me in Microbiology _Dr. Swati. Thank you again on behalf of Instant Microbiology and Biotechnology. Thank you.